Hello friends, I am Dr. Sunil Apsingi, orthopedic surgeon at Medicover Hospitals, Hyderabad. Today we shall talk about meniscal tears and meniscal injuries. Normally these injuries are associated with ACL tears. As we all know, the ACL tears are very common, and normally these happen because of either road traffic accident or falls at the time of sports pivoting activities, what we call. That is when you're running and trying to change the direction or suddenly twist your knee and fall down, then you have an ACL tear. And ACL tear causes this instability in the knee joint, and that results in meniscal tear. Menisci, if you see, there are two of them, one on the outer side, one on the inner side. They are C-shaped, and these things, when they are torn, they cause a problem. So why do they cause a problem when they are torn? They cause a problem because of two reasons. Number one, they are very important in weight bearing in the knee joint. And number two, they give stability to the knee joint. So they cause problem with both stability as well as weight bearing. Hence, it is very important to treat these menisci. People with these meniscal tears normally present to us with severe pain. Locking. Locking is when you have a sudden loss of movement in your knee joint, where you can't bend or extend your knee joint, and it causes severe pain. So this is very typical symptom of people who have a meniscal tear. Suddenly they have a locked knee, and within few minutes, sometimes within few seconds, it just gets unlocked by itself. Sometimes people come to us with a locked knee which is just not unlocking as well. So these are the symptoms of a meniscal tear. Treatment for these meniscal tears is surgical. Because this is a mechanical problem wherein something is coming in between the two bones and locking the joint, the treatment is surgical. Here you cannot treat it without surgery. And what are the types of surgery for this problem? Number one, more often than not, it is involved with an ACL tear, hence an ACL reconstruction is required. For the meniscus, you can either remove it or repair it. What are the problems with removal? Once you remove it, you can't get your meniscus back. So in one shot you remove it, you won't get it back even if you want it. So removal is a one-shot surgery, and removal makes your knee more unstable. You won't be happy with your ACL reconstruction, and also removal causes arthritis in the knee joint. So if you ask me, if a meniscal tear is repairable, removing it is not a good choice at all. What about repair? Repair of a meniscus can be done through an arthroscopic procedure. It involves putting a few stitches into the meniscus inside the knee joint and stabilizing the meniscus. Repairing the meniscus, especially when associated with an ACL tear, is a very successful procedure that gives you a very stable knee, and more importantly, a knee which is protected from future arthritis. So if you have an ACL tear with a meniscal tear, the first option has to be to repair the meniscus. ACL is anyway reconstructed. Once we repair the meniscus, the result of the surgery is far superior to ACL reconstruction with removal of the meniscus. Hence, you should always consider a repair of the meniscus.